This is a very common USMLE question where there's a graph given between lung volume and transpulmonary pressure, that is a PV curve. And the question reads, graph 1 may indicate ARDS, emphysema, lung fibrosis, atelectasis. So over here, the graph, if we talk about the slope of the graph, so slope over here will be your change in volume, that is change in the y-axis, by change in pressure, which is del y by del x. Now change in volume by change in pressure, this quantity is nothing but what we call as the lung compliance. This is your lung compliance. Lung compliance simply means a measure of output based on the input you have given. So in case of lungs, the input that you give is your inspiratory effort, which causes a change in transpulmonary pressure, which is dP. And based on that, you measure the output, that is how much air fills in the lung, that is the tidal volume or the volume of air entering the lung. So the lung compliance is del V by del P. Now basically the slope will be over here, in case of, if this is the normal slope, now then this slope is an increased slope, and over here this one is a decreased slope. So increased graph 1 simply represents an increase in slope. That means there's an increase in compliance. Now increased compliance is seen in case of conditions where there is a lung wall damage, or the lung wall becomes more malleable or more deformable. So over here, these conditions, over here ARDS, there's decreased compliance, lung fibrosis decreased compliance, atelectasis decreased compliance. So emphysema is the only option where we have an increase in compliance. So this will be our correct answer.